Hi, this is Dr. Reynaldo ROJoson, Director of the ROJoson PEP Talk. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the PEP Talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer. My pep talk today is entitled Fundamentals and Generalities in the Medical Management of Abdominal Disorders, an Overview. This is part of the Health Disorder course. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities of the medical management of abdominal disorders. These are the modules for the abdominal disorder course, abdominal disorders overview, which will be taken up today, abdominal pain, abdominal mass, obstruction, abdominal bleeding, jaundice, gallbladder disorder, hemorrhoids, and abdominal hernia. The contents of the abdominal disorders on overview will be the following. What is an abdominal disorder? What are the different types of abdominal disorders? What are the causes of abdominal disorders? How common are the abdominal disorders? Clinical diagnosis of abdominal disorders, paraclinical diagnostic procedures for abdominal disorders, and basic treatment modalities for abdominal disorders. Definition of terms in the title and the limitation of coverage of my talk. The word fundamental will be used to mean simplest essential facts and theories which can serve as a basis or foundation and support for advanced information. Generalities, the word to mean general statements of information, not covering specifics and not too detailed. Medical management, diagnosis, and treatment by physician. Let's start with the first topic, which is what is an abdominal disorder. First, the meaning of disorder. Disorder is a definite disruption to the regular bodily structure and function, but the specific cause is not yet determined. Once identified, the specific cause is called the disease. Second, the meaning of abdomen. Abdomen is simply the belly. It has the abdominal wall, and within it is the abdominal cavity or body space. The belly or abdomen is below the thorax or chest. The diaphragm forms the upper surface of the abdominal cavity. It serves as the boundary between the abdominal cavity and the chest cavity. In the abdominal cavity are various organs such as the liver, gallbladder, stomach, small and large intestines, pancreas, spleen, kidneys, urinary bladder, uterus, ovaries, etc. So abdominal disorder is a disorder of the abdomen, and it is a definite disruption to the regular bodily structure and function of the belly, inclusive of the abdominal wall and the organs inside the abdominal cavity. But the specific cause is not yet determined. So thus, an abdominal disorder is a disorder of the abdominal wall, organs and tissues within the abdominal cavity. Again, the liver, the gallbladder, the stomach, small and large intestines, spleen, pancreas, kidneys, uterus, and ovaries, etc. Once the specific cause of the abdominal disorder is identified, then a diagnosis of the disease is given. Example, abdominal wall disorder, you can have a disease called hernia or soft tissue sarcoma, or the liver, hepatoma, it's a form of liver cancer, cirrhosis, gallbladder, gallbladder stones, stomach, gastric ulcer, gastric cancer, small and large intestines, enteritis, cancer, spleen, hematological, splenomegaly, cancer, pancreas, pancreatitis, pancreatic cancer, kidney, kidney stones, cancer, uterus, ovaries, examples would be myoma and ovarian cancer. The second topic is what are the different types of abdominal disorders. The common different types of abdominal disorders are the following: abdominal pain, abdominal mass, abdominal obstruction, abdominal bleeding, and jaundice. So these are the 5 common disorders with various specific causes which are not yet identified at this point. Abdominal pain is sakit ng tiyan, abdominal mass, bukol sa tiyan, abdominal obstruction, barado sa bituka o tubo sa tiyan, abdominal bleeding, dugo sa or galing sa tiyan, jaundice, paninilaw ng mata na apektado ang atay. The third topic is what are the causes of the abdominal disorders. Okay. So on the left-hand side, you have the disorders listed down here, and then we have to identify the different causes of the disorders. Let's start with abdominal pain or sakit ng tiyan. Causes can be from trauma and non-traumatic causes. Among the non-traumatic causes, pain can come from an abdominal mass with different sub-causes, abdominal obstruction, abdominal bleeding, and jaundice. Abdominal mass or bukol sa tiyan, as illustrated. Abdominal mass can originate from the belly, meaning from the abdominal wall, as well as organs and tissues within or inside the abdominal cavity. And the specific causes can be cancers or non-cancers and abscess. And abscess can also form into a mass. Abdominal obstruction or barado sa bituka or tubo sa tiyan. So any tubes in the abdominal cavity that can channel or that channel fluid or foods can be obstructed. So examples are stomach, which is a hollow organ, small intestines, large intestines, hepatobiliary tree or duct, which channel the bile from the liver into the intestine, and then the ureters, which channel the urine from the kidney to the urinary bladder. So this is an example of obstruction of the intestines. Okay. So here, showing a obstruction at the level of the large bowel, okay, large intestine, okay, showing distension of the proximal or the segment of the intestines just above it. Okay. Example of a biliary tract obstruction caused by stones. Okay, these stones can block the drainage of the bile from the gallbladder, and then if it reaches the common bile duct, again, it can also block the common bile duct. Ureter, okay, an example here, obstruction at this level of the ureter causing dilatation of the ureter above it and also the kidney. So abdominal obstructions can be caused by cancer or non-cancers like benign tumors, adhesions, intussusception, and abscess. So a picture illustrating tumor in the large intestine as a cause of the intestinal obstruction. Okay. Adhesions after an operations, usually causing obstructions. Intussusception, in which the front segment, the intestine goes inside the lumen of the adjacent intestine. Abdominal bleeding, dugo sa or galing sa tiyan. Abdominal bleeding can originate from the belly, the abdominal wall, as well as the organs or tissues within the abdominal cavity. It can be caused by trauma or non-trauma. For the non-traumatic causes, you can have cancers, non-cancers, such as benign tumors, ulcers, hemorrhoids, and infections. So there are two general categories of bleeding, gastrointestinal bleeding. One is called the upper gastrointestinal bleeding, which just means it comes from the upper part of the gastrointestinal tract, usually from the stomach and duodenum. And the lower GI bleeding, it comes from the lower part of the gastrointestinal tract. Usually, example will be coming from the rectum, colon, ileum, and jejunum. Jaundice, paninilaw ng mata na apektado ang atay. Okay, so there are different causes, but the more common causes are liver disease and biliary tree disease. The specific causes would be cancer, non-cancer tumors, cirrhosis, and stones. How common are the abdominal disorders? Among the five, the most common is still the abdominal pain, okay, but the others are also common. Clinical diagnosis of abdominal disorders. Tips: start with identifying the disorder based on the symptoms. Okay. So disorder can be abdominal pain, mass, obstruction, bleeding, and jaundice. Then identify the specific cause. So look for cues for the specific cause or disease causing the disorder. Use pattern recognition of a particular disease and prevalence process in those with similar presentation of symptoms and signs. The basic evaluation methods consist of history taking and physical exam. History taking to get the symptom data and physical examination to get the sign data. And after these symptoms and sign data are gathered, they are processed to come out with a clinical diagnosis. The basic data needed in the history will be when the initial symptoms were noted, what was the subsequent course, and then are there associated symptoms. So all of this can give the clue to the diagnosis. As to the physical examination, the basic data needed are, after looking and palpating, so you look for a bulge, okay, which can suggest a mass. Look for distension, which can suggest an intestinal obstruction. Palpate for a mass, palpate for tenderness or pain. So in the examination of the abdomen, as I said, look and palpate. Look for any unusual bulge that may suggest a mass. Look for abdominal distension that may suggest intestinal obstruction or a mass or fluid. Palpate for a possible presence of a mass. Then palpate for the presence of tenderness, which is pain on pressure. If present, note down the location and severity. So like here, look for the unusual bulge that may suggest a mass. distension, which may suggest intestinal obstruction or mass or a fluid. Then palpate for possible presence of mass and presence of tenderness. For the abdominal pain, the tip is to use the location to suspect the possible organ of concern. So the abdomen is divided into several areas: epigastric region, periumbilical region, and pelvic region. Another way of classifying it will be right upper quadrant, upper left quadrant, lower right quadrant, and lower left quadrant. Okay. So if you have some disorder, some symptoms or pain on the right upper quadrant here, so the liver might be involved or the gallbladder might be involved. If you have pain on the left lower quadrant, so you might consider problems in the intestines and also in the uterus and the ovaries in this area. In patients with abdominal pain, ask and use the nature of the pain to suspect the possible organ of concern, whether a hollow or solid organs are involved. The abdominal organs are usually made up of solid and hollow organs, such as the intestines. A crampy abdominal pain, usually it connotes that the pain is coming from the hollow organ, like the gallbladder, stomach, intestines, etc. If the pain is not crampy, usually solid organ or peritonitis, which just means an inflammation of the lining of the abdomen. So again, for abdominal mass also, just like abdominal pain, use the location to suspect possible organ of concern. So if you have a mass located in the right upper quadrant, you might be dealing with a mass in the liver. If you have a mass on the left lower quadrant, you might be dealing with a mass coming from the large intestine, the lower part of the large intestine. For gastrointestinal obstruction, the cues are the following: abdominal pain, vomiting, abdominal distension, and no bowel movement. So the practical tips to do will be palpate for a mass as a possible cause and location of the obstruction. If there is no mass, consider adhesions in patients with a history of abdominal operations. And then one can also use the color of the vomitus as cues for site of obstruction. Okay. So if the vomitus is not yellow or green, usually the obstruction is at the level of the stomach and upper part. If the vomitus is yellow or green, then it's below the stomach. For gastrointestinal bleeding, the cues will be the following: vomiting of frank blood, red blood, passage of frank blood, again, red blood per anus, black stools per anus. So the tips in evaluating persons with gastrointestinal bleeding: palpate for a mass as a possible cause. If no mass, use the color of the vomitus and stools as cues, whether it's upper or lower GI bleeding. Upper GI bleeding usually have vomiting of frank blood and black stools per anus. In lower GI bleeding, there's passage of frank blood per anus. As to jaundice, the cues, simple cue will be yellowing of the eyes, the white part of the eye. So palpate for a mass in the liver as a possible cause. If no mass, look for symptoms suggestive of hepatitis, gallbladder disease with stones in the biliary passage, or pancreatic disease. These are common diseases causing jaundice. Paraclinical diagnostic procedures for abdominal disorders. The common instrumental and laboratory diagnostic procedures for abdominal disorders are the following. Imaging procedures such as X-ray, which could be plain or with barium dye, ultrasound, CT scan, MRI, PET scan, etc. Or another common instrumental diagnostic procedure would be endoscopy. Okay, you have the upper and the lower. The upper endoscopy is usually called esophagogastroscopy. This is used to scope and examine the esophagus and the stomach. Lower endoscopy, colonoscopy, sigmoidoscopy, and proctoscopy. These are part of the colon, okay, the whole colons, colonoscopy, and sigmoid colon and the rectum. Blood tests such as CBC, liver function tests, hepatitis profile, tumor markers, etc. are also commonly used as indicated. The competencies required of physicians managing abdominal disorders are the following. They should know the uses and indications of all known instrumental and laboratory diagnostic procedures for abdominal disorders, okay, and then use them as needed and indicated. Select the most cost-effective one using the BRCA process. Know how to interpret the results. So these are the competencies that are expected of all physicians. So illustration of the BRCA process in selecting diagnostic procedures. First column, put down the options. B is benefit. So the goal is to be more definite on the diagnosis than the risk, the cost, and availability. BRCA. Basic treatment modalities for abdominal disorders. So the basic treatment is surgical, outright surgery, or non-surgical. Non-surgical treatment at all times, no intervention is needed. And then in some cases, it could be potentially surgical, okay? And it becomes a surgical only when indicated or when needed. Okay. So these are the usual treatment modalities for abdominal disorders. Okay. So surgical, non-surgical. Okay. For the surgical, you add another option is potentially surgical. So examples of surgical abdomen, meaning conditions that need surgery, will be peritonitis in patients with abdominal pain, operable cancer in patients with abdominal mass, obstruction by a tumor in patients with abdominal obstruction, tumor bleeding in patients with abdominal bleeding, and obstructive jaundice caused by stones and other, and even tumors can be, okay, a surgical condition for patients with jaundice. The BRCA process is again used in selecting the cost-effective treatment. First column, the options, benefit. Now, the benefit is in terms of the goal of treatment. Okay. Then R will be the risk, C will be the cost, and then availability. So summary and takeaway. Okay, I have discussed all these topics. What is an abdominal disorder? Different types, causes, how common, clinical diagnosis, paraclinical diagnostic procedures, basic treatment modalities for abdominal disorders. Takeaway in relation to patient empowerment. Be always in touch with reliable medical information on fundamentals and generalities in medical management of abdominal disorders. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of abdominal disorders. So with that, I end my pep talk. I hope I have empowered you to have a better understanding of the fundamentals and generalities of the medical management of abdominal disorders. Thank you for your attention. Mabuhay kayong lahat.